Now, KDKA exclusive. Sunday marked the 5th anniversary of the Sago mine disaster. 12 miners were killed in the explosion. 1 survived. The fact that Randall McCloy is alive today is nothing short of a miracle. Years after the deadly blast, he continues to defy the expectations of doctors and live a normal life. Stacey Smith recently sat down with 2 of those doctors. He's here now with the story. Stacey.
Ken, defying the expectations may be an understatement. In fact, the doctors who treated him don't hesitate to use the word miracle. Randy McCloy was about as close to death as you are ever going to be and still be alive.
We got a call around midnight, being the closest level 1 trauma center, that there were 12 surviving miners found.
That was nearly 41 hours after an explosion at the Sago mine in West Virginia trapped 13 miners in the early morning of January the 2nd, 2006. They were only 280 feet underground, but they were enveloped in toxic fumes of methane gas and carbon monoxide.
So we geared up our hospital, Ruby Hospital, only 3 hours later to get another call that there, in fact, was only 1 survivor, and that was, of course, Randy McCloy.
The other 12 miners had perished. All of them died of carbon monoxide poisoning, and Randy McCloy was probably only minutes away from dying when he was rescued.
Randy was on death's doorstep, there was no doubt. He was deep in a coma. He had had a massive heart attack. He was in heart failure, liver failure, kidney failure, hypothermic, hypotensive, and dehydrated. Other than that, he was fine.
Dr. Julian Bales and his team at Ruby Memorial in Morgantown were able to stabilize the 26-year-old McCloy, treating his heart and kidneys and removing as much carbon monoxide from his blood as they could. But McCloy was still in a coma, and they had to get the remaining CO2 out of his brain, and they had to do it quickly. But even if they did, there were no guarantees.
We always in neurological medicine worry about saving the patient, but them not having a normal brain. And sometimes the families at the end are disappointed because someone may live as a vegetable forever.
McCloy's family had faith, though. He had made it this far, but the next step had to be taken here in Pittsburgh at Allegheny General Hospital in something called a hyperbaric chamber. It is a capsule that is highly pressurized, an environment that permits oxygen to penetrate vital tissues and helps the body to rid itself of carbon monoxide. A day and a half after he was rescued, he was brought by ambulance from Morgantown to AGH. But almost immediately, as they took Randy McCloy out of the ambulance and into the hospital, he had to be resuscitated.
When he got here, we counted 21 medical problems. Every system in his body had failed.
Dr. Antonios Zikos and his hyperbaric crew stabilized the young miner and immediately put him in the chamber. When you put Randy McCloy into that hyperbaric chamber and you closed that chamber door, what did you think? Did you think he would survive?
We had our doubts. I prayed a lot, I can tell you that.
McCloy was sealed in the chamber for 90 minutes for his first treatment. And those prayers, they may have been needed.
The first treatment was quite scary because he actually got worse. His pulmonary edema, the fluid in his lungs, became centralized and required a lot of oxygen. But the second treatment got a little bit better, and the third treatment was marvelous. It was almost a miracle. So after the third treatment, we had a dramatic improvement in every organ function.
The miracle was taking hold. Within 24 hours, Randy McCloy's fortunes had changed dramatically. The next day, on January the 7th, he was taken back to Morgantown. And then, after 3 more months of hospital treatment and rehab, he was back at home.
Are you surprised he survived this?
Yes, I am. We know from the literature, if somebody has a cardiac arrest with carbon monoxide poisoning, the mortality rate is 100%. No one survives.
Randy looked absolutely on death's doorstep, and he is the longest known survivor of this sort of exposure to carbon monoxide and methane poisoning. So in a way, I'm very surprised. Our backs were against the wall, as was his. But sometimes miracles do happen.
Again, there is no medication, no pill or shot that can reverse the effects of carbon monoxide poisoning. But besides the hyperbaric chamber, Dr. Bales is giving a lot of credit to something else for Randy McCloy's recovery, and it is something that perhaps your doctor has recommended that you take: omega-3 fatty acid or fish oil. Randy McCloy was given up to 16 times the normal amount, and Dr. Bales believes that also helped Randy McCloy's brain recover.
Man, I remember how bleak it looked. I mean, we all remember, and it's hard to believe it's been 5 years.
When I talked with him, I had not realized how bleak it really was. He arrested inside that hyperbaric chamber as well, and that was tough to take care of him, you know, when he's in that pressurized environment.
I'm sure. And what do you know about how he's doing today?
Well, I asked Dr. Bales that. Randy McCloy has declined most interviews. He's done a couple here or there soon after the accident, but basically, according to Dr. Bales, he's living a normal life. He's fathered 2 children since the accident, and he now lives just a quiet life in his hometown.
Wow.
Yeah.
And if anybody would have told you that, you know, 5 years ago right now, that's an incredible story.
Yeah.
Stacey, thanks.